Was I too quick for you? It's Christmas Eve, right? Good to go? Well, good morning, Queensland, and Christmas Eve. Can I wish everyone a very merry and safe Christmas, particularly people who will be travelling on our roads over the Christmas New Year period. I really ask people to just follow the road rules and, of course, do not drive while you're tired. Take those breaks, make sure you get to where you're going safely. We don't want to see any fatalities on our road during the Christmas period. As we move into this new phase of managing COVID in the community, I want to acknowledge and thank everybody for the tremendous work throughout 2021, particularly, of course, our frontline health workers who have done such an extraordinary job in keeping us safe. Of course, all those ones who are manning our testing and our vaccination centres, including our private pathologists as well. We say thank you for the great work you're doing. To our Queensland Police Service who have been manning our borders and helping protect us for the last year as well. I just want to give a big shout out and say thank you to everyone, and of course to Queenslanders. We are standing here today with our vaccination rates at 90.25% first dose and 85.65% double dose. That is extraordinary for an immunisation program that only started in February, and in 10 months we have over 90% of our eligible population already having one dose. There is no other immunisation program in this country or the world that has been able to deliver that within that sort of time frame. And I want to say thank you to Queenslanders for coming out and getting vaccinated. We've asked so much of you, and you have done so much throughout the last 2 years, and we are so grateful because it has put us in the best possible position to be able to move forward and manage these growing cases in our community as we move into 2022. When we do look at our numbers today, we have 589 new cases. That puts us at 1,389 active cases, and we've had 30,684 tests in the last 24 hours, so thank you for people continuing to come out and get tested, and thank you to all our public and private testing clinics operating across the state. And over 11,315 vaccines, more than half of those are boosters in our state clinics. So it's great, and we've heard the announcement this morning from Greg Hunt and the Commonwealth that they're bringing forward the booster shots and the eligibility for booster shots. So that is great news, and I say to everyone who is able to get their booster earlier than planned based on these time frames, that we strongly encourage you, particularly going to your community pharmacy or your GP, because we know as we move forward we need these boosters to become part of just our normal immunisation program and getting those vaccinations done as quickly as possible. And there's been 30,631 new border passes issued in the last 24 hours, bringing us over 322,000 border passes since we opened on the 13th of December, which shows that many people are still flocking to Queensland. Now, I do want to give a reminder to Queenslanders. We have implemented a mask mandate. We've done this for a reason. All of the health advice around the globe have said that vaccinations on their own is not enough, especially with Omicron. We need to also have other measures. And we know that masks are a very important part of our fight against COVID, and it's spreading more throughout the community. So I want to remind people that no matter where you live in Queensland, it is mandatory to wear a mask, both staff and customers in our retail settings, and it is mandatory for staff to be wearing their masks in hospitality. Now, I know for many people across Queensland, this is a first to have to wear masks, but it is so important, and we know from the past that they do work. Now, we're seeing about 2/3 of the population probably complying with those rules at the moment. It's not fair to those people who are doing the right thing, for those not wearing their masks, to let everyone down. So please, put your mask on. And I know I said this a few months ago, and I'm going to say it again. Wearing your mask under your chin is not wearing a mask. It's not going to keep you safe. So please, wear your mask properly. Make sure it's covering your nose. Of course, you can take it off to eat and drink, but it's so important that where it is mandatory, everyone is complying. Mask rules will be enforced, and also remembering that we strongly recommend wearing a mask while you're entering and exit hospitality venues as well, or any other venues indoors where there is a risk and you cannot socially distance. It's really important. We know it's going to be particularly important over the next few days as large gatherings of people come together for Christmas and Boxing Day and as we lead into the new year. The Chief Health Officer will talk a little bit more about our cases. I'm pleased that our numbers needing hospitalisation are still very, very low in this state, and that's a reflection, of course, about our high vaccination rates as well. But we know people can get sick from this virus, and it's important that you get vaccinated to keep yourself as well as possible and, of course, your loved ones, and slow down the spread of this virus in the community. But we've had 32 of the 77 local government areas of Queensland now had positive cases show up since the 13th of December, since we opened our borders. 32 of the 77. And that just reiterates what we've said all along, which is the virus is going to come to every single community in Queensland. How prepared we are will be dependent on how compliant people are with the rules that we're putting in place and, of course, our vaccination rates. So, as great as the vaccination rates are, that isn't consistent across the state, and we still expect and require people to come out and get vaccinated as quickly as possible to get that protection. The other thing I'm announcing today is our next phase in the strategy to manage COVID as it spreads throughout Queensland. And that is our COVID pathway. Now, this is how we care for people in the community and in our hospitals. Our COVID care pathway is there for everyone to see on the COVID website. You can find many, many materials about how this will be managed for clinicians, but most importantly for the public. How can you prepare yourself for becoming positive with COVID? And there are fantastic materials and a toolkit prepared. So think of it this way, Queenslanders. You need to get ready for COVID. And by getting COVID ready, you're doing the same as we prepare for our bushfires, for our cyclones, for our floods that we do every year. We get ready for storms. Now you need to get ready for COVID. And we have toolkits, materials that are prepared for people to tell them what happens when you get a text saying you're positive. And the text is being updated and will change today to not just talk about being isolated, but link you to the materials. So you know what happens next when I get a text saying I'm positive. There'll be 10 things you can do to get ready for COVID, including preparing a Get COVID Ready kit. Things like having a thermometer at home, pain relief, regular medications, a plan of who may look after your children if one or both parents end up unwell and needing hospitalisation. And this is something we've particularly learnt from interstate, where there are situations where both parents ended up hospitalised. So don't wait until you're both sick. Plan now who could care for your children if you do need to go to hospital. Having masks and hand sanitizer and gloves. And also making sure you've got enough essentials for 2 weeks at home. So all of these materials are now available on the website. There's a My COVID-19 Symptoms Diary, so you can track your symptoms if you're being cared for in the home, and also what will happen if you need to go to hospital. This is a great step forward to help empower the public to understand exactly what will happen if you get positive, but also how to plan for that to make it as smooth as possible to help you feel confident that you can stay at home if you're unwell or if you're not seriously unwell and needing hospitalisation, and what to look for symptoms. Of course, the message is very clear. If you become very unwell and you're concerned at all, you should call 000. and go to the hospital. I want to thank our consumer networks, our general practitioners and our hospital and health services who have helped us co-design all of these materials that are available and we are launching today. This will prepare our hospitals to go forward. This will help the community understand what it means for them to get COVID, and will help everyone plan and manage their illness if they do end up with any symptoms as we go forward. I just want to again thank everybody for all of the hard work, all Queenslanders throughout 2021, and wish you all the best for Christmas. So I hand over to the Chief Health Officer and hear a few more about these cases. Thank you.
Thank you very much, Minister. So today in Queensland we have 589 new cases to report. We have just 3 people in hospital with mild to moderate symptoms. So we have no patients in Queensland with severe COVID-19. This brings the total number of cases of COVID seen in Queensland to date to 3,564, with 1,389 currently active. There have been 1,365 cases in Queensland diagnosed since the borders were opened last Monday, the 13th of December, and this excludes overseas acquired cases. What this shows us is that the vaccines are working. The vaccines are clearly working. But what I have a very important message, and I think this really needs to be made clear. In the coming weeks, we will be seeing large numbers of cases, thousands of cases. Even though the proportion of people getting severely ill with this disease was going to be very small, when you have large numbers of cases, that will translate to a significant number of people that has the potential to put a strain on our hospitals. So that is why the masks are so critical. There are 2 reasons why the masks and the other measures are so absolutely vital. One, to reduce the strain on the hospital that will occur. There will be some strains on the hospital in January simply because of the large numbers of cases in the community we are expecting. And 2, to give as many people as possible the opportunity to get that boosted dose, particularly those people that are vulnerable, the elderly, those with underlying immune disorders, etc. So clearly the vaccines are working, the numbers of sick people we are seeing, so significantly sick people, are small, but because we expect large numbers of infections because of the very contagious nature of this Omicron variant, it is likely there will be significant numbers of admissions to hospital, and you can help by wearing those masks. And the masks perform 2 tasks, and they're equally important. They protect you, but they also protect other people from you, because if you're vaccinated particularly, you may be carrying the virus and you may not know it. And so you could potentially transmit it to someone else. So by wearing the mask, even if you feel well, you may be protecting other people. So I'll continue. There were 30,684 tests completed yesterday, and I thank everyone who came out to get tested, those who had symptoms. I understand there were some queues. We have 350 testing locations across Queensland, including both public and private providers. There were 11,315 vaccinations given yesterday, and again I'm very pleased to say more than half of these were 3rd doses. So 85.65% of Queenslanders 16 years or older are now fully vaccinated, and 90.25% of Queenslanders have received at least 1 dose. Locations where we're now seeing cases, or we've seen cases in the last 24 hours, include Brisbane South, Brisbane North, Bundaberg, Cairns, Douglas Shire, Fraser Coast, Gladstone, Gold Coast, Gundawindi, Gympie, Ipswich, Lockyer Valley, Logan, Mackay, Mareeba, Moreton Bay, Noosa, Redlands, Scenic Rim, Southern Downs, Toowoomba, Townsville, Western Downs and Whitsunday. This virus is everywhere, And so it is somewhat surprising that despite the fact that it is everywhere, we are seeing relatively few sick patients in hospital. And that's because the vaccines are working. But the numbers of people we're going to see with this virus in the next few weeks is going to grow very substantially. And even with that very small proportion of people getting sick, that will have an impact on the hospitals. We're moving steadily towards caring for more patients in their homes. We currently have 268 patients being looked after in their homes. There are 110 people in hospital, but as I've said, only 3 of those are really being treated for COVID symptoms, none severe. The rest is still in hospital for other reasons, but we are continuing to develop measures for getting people out of hospital for their care. Thank you very much.
Doctor, tomorrow is Christmas Day. Do you have any advice on how to do Christmas safely, and can you still hug Grandma?
I think a couple of things. If you can have activities outdoors, that's a great start. I would probably limit contact between individuals over the Christmas break. Hugging Grandma, well, I'm going to hug my mother. I think I'm not going to say to stop that for Christmas Day. I think that would be probably going a little bit too far. Obviously, if you have any symptoms, if you are unwell, please don't attend Christmas events. And if you're not vaccinated, stay away from everybody. Don't go to any Christmas event if you're not vaccinated.
Just on the, what should we go to?
We might have the Deputy Director come back to questions.
Thank you. Thank you, Minister. Thank you, Dr. Gerard. Can I just join the Minister in saying for everyone, the focus for us this holiday season with Christmas is to keep everyone safe. And certainly it's not just about COVID, but I will concentrate on that today. But the messages are clear around when we're travelling, around road safety and what's expected there. But let's talk about COVID as well, because I think it's very important that we don't drop the ball on that, and I want to dwell on some of the things there. It is very high, the operational tempo, so 38,719 vehicles checked across our borders yesterday. 151 were still refused entry. Our air borders got very busy yesterday, so 12,287 passengers were checked, but very good levels of compliance, so 17 refused only and 51 placed into quarantine. I did want to talk about the compliance rules. I met with all of our senior officers, our district officers yesterday virtually to talk about the posture we will take. We handed out 208 masks yesterday. We are still handing out way too many masks. That means people are not carrying their masks and they're not wearing their masks when they should do that. And we fined 2 persons for failing to wear masks when they were given the opportunity. We're going to take a very close look at that. Whilst we're seeing very good compliance in some areas, particularly Brisbane, well done Brisbane, seems to be very compliant with masks. I have been out and about and I have seen in other areas that the level of compliance around mask wearing and checking in is not where it needs to be. So our police have been asked to be very visible and very present, and people can expect to be challenged. If we don't see our compliance improve, we may have to take a stricter line on that, but we'll continue to monitor that. We did check 138 businesses yesterday, and again I just want to say to the vast majority of businesses out there that are doing the right thing and doing it well, thank you so very, very much for that. But of course there are some doing the wrong thing, and we saw a business in Toowoomba was closed down, which is really, really disappointing. They were given ample opportunities to comply with the current directions and the current rules that are in place, deliberately chose not to, made a mockery of the whole system and have now been closed down. Any person and any business that does that kind of thing can expect us to take enforcement action and very strict action about that. The law is clear. People are entitled to their opinions. The law is clear. We will enforce it. We did respond to 82 calls for service yesterday, so they related to 23 persons and 59 businesses, all of which were resolved fairly benignly, so I'm happy to say that most of those were not issues we had to take action in relation to. I'm just going to finish off by saying to all the emergency services workers out there who will work through the Christmas and New Year break, thank you so much for what you do, and to my colleagues in police, I'm immensely proud of the work that you're doing every day, and thank you, and wish you all a Merry Christmas. Thank you.
Minister, we've heard that obviously the new Brisbane news today, I think there's about 7.5 million people will be eligible by January 4, 16 million by February. Do you have any concerns about supply of vaccine in Queensland?
The Commonwealth has said that there is adequate supply. We have to assume that's accurate, and it's about making sure that supply gets to us quickly. So I know pharmacies were a little bit concerned a week ago when the first announcement was made of moving it from 6 to 5. They got quite a rush. Now that we've got this notice a little bit in advance this time, hopefully all of us are going to be able to bring forward our orders and make sure that we've got the deliveries ready to go. We do want boosters to really become part of our normal immunisation program. So people popping along to their pharmacies. We heard the Pharmacy Guild saying, you know, you don't need to wait at long lines of vaccination centres. We should be able to just pop along to our community pharmacies or our GPs and get our booster as soon as possible. But of course there will be vaccination centres, both state and Commonwealth, that will also be providing those boosters. And then in the new year we'll be delivering the 5 to 11-year-old vaccinations as well. So there'll be a lot of vaccinations still happening in the new year, and we're certainly prepared for that.
The Target has said states are allowed to bring their booster rollout forward even sooner if they have the capacity.
Yeah, look, I just saw that. Literally, as we're walking into the press conference, I saw that in Greg Hunt's press release. I don't know what that means. We haven't had that communicated to us. I think it does create a little bit of confusion. I think we'll work to the 4th of January timeframe. We've already got people coming forward already at the 5-year mark for their booster. 4 months will kick in on the 4th of January, and then at the end of January, 3 months. So that's what we'll work towards, because we've still got people who are coming in for their first dose, we've still got people coming in for their second, and then we've got the boosters as well. So we have to manage all that, but certainly there will be exceptions to that. There will be particularly vulnerable people, and I know immunocompromised people are already able to get 3 doses plus a booster. So, you know, we'll be working through all of that. The main message is when you're eligible, come forward and get vaccinated.
How many Queensland Health and Hospital staff are in isolation at the moment?
So I've seen some of the reports overnight. There's 21 at Redcliffe Hospital. There are a number elsewhere in the state, that are in quarantine or are positive. So the thing we have to remember, and we've planned for this all along, is that our health workers, whether it's fire and emergency, ambulance, police, our doctors and nurses, they're like everyone else. They're out in the community every single day. They can get the virus while they're grocery shopping, while they're going to the movies with their kids. So we've always planned that we should expect that health workers will need to come offline because they're positive and they're isolating, or their staff that are quarantining. And that's what we've been working through. That's why what we're releasing today, which is the COVID care pathway, is so important, because we know that our health workforce at our hospitals will come under strain in a whole lot of ways. Not just how many positive people are coming in, but it's also health workers having to go offline. I'm looking at what's happening in the US. They've actually brought in the military to start helping in their hospitals in the United States. So we have been planning for this. We're very comfortable where things are at. It's up to the public health units to be looking at who is a close contact and who is a casual. But business continuity is a key for us, and we've always worked on that.
Do you have a figure though, an overall figure?
I don't have the total figure. We've got to remember it's changing every day. As a new exposure site goes live, there are more people who are close contacts or casual contacts. So any figure we have will constantly change. There'll be people who come out of needing to quarantine because they were a casual contact, they've had their test result, they're clear, they're back at work. There'll be those who are close, there'll be those who are positive and will be isolating. The figure's going to change all the time, and we should expect that there'll be a lot more of our frontline workers who will be offline because they are like everyone else and could end up positive.
I guess the difference is they're sort of delivering an essential service.
That's right, and we manage that business continuity. Every day the public health units will make that analysis and assessment, and we've got all that assessment there for the clinicians to look at, for the public health unit to look at. How do we make sure we've got business continuity? We've done the same thing for our power stations and essential infrastructure and services in this state, where we have said even if you are close contacts, there'll be circumstances where we will allow you to continue to go to work, but we'll have other measures around you. We'll do the same with health workers.
Would it be in the hundreds? I mean, can you give us a rough steer?
I don't have a total figure today. I don't believe it's in the hundreds, but there could be over 100 health workers across different hospitals at the moment who are either isolating or quarantining, and I would expect that because it's a reflection of the fact that we're seeing an increase, a doubling of cases every 48 hours at the moment.
7-day isolation for close contacts, is that sustainable? Given yesterday we heard the spread of the virus is necessary, cases are expanding, is that actually sustainable to isolate?
Look, that's the current national guidelines for quarantining, but also, who is a close contact and casual will continue to be refined as they work forward. So it may be that you're not necessarily changing the 7-day quarantine period for vaccination people, but that less people are deemed to be close contacts, which means they're not caught by the 7 days anyway. And they may simply be a casual contact who's got to go get a test and wait for a negative result. So all of that is being constantly managed and monitored. And I know the Chief Health Officer is in direct contact with the health officers across the country as to any changes that need to be made or should be made in that space. And we'll take advice from those health officers.
So we're still seeing testing queues around the country extraordinarily long. Anecdotally, we know tests are starting to take longer than 72 hours to come back in Queensland even. 5 of the 15 rapid antigen tests approved by the TGA are classed as having a very high sensitivity, clinical sensitivity greater than 95%. Why aren't they a good enough substitute for PCR tests right now?
Well, there are many, many states that are still using PCR as a required test. It is in our plan. It is what we have put up as our our requirement for the public at this stage. Remembering, you won't need any test whatsoever if you are coming from a hotspot when we hit 90% double dose. And we are getting to that 90% double dose very quickly. But for this small window that we have remaining, the number of weeks that we have before we get to that 90% double dose, we do need to make sure we're managing this. We do need to make sure we have hundreds of cases every day now. We need to make sure that we can manage this and our health system can manage this. We promised the people of Queensland we would do this in a safe, responsible way. Now, the Premier said yesterday that they're taking further advice from AHPPC around rapid antigen tests and that we will look at this, if this is approved, to utilise in the new year from the 1st of January. So the Premier said that yesterday. We stand by those comments. In the meantime, we do require PCR tests. Just on the test, can I say we're updating the testing sites today as well for the Christmas period. So we have waived the referrals for all private pathologists. So people will be able to go to public or private pathologists to get tests over the Christmas period. There will be some private pathologists who will not be operating, for example, Christmas or Boxing Day. So please check the update on the website. But there will still be many, many places you can go get tested. And we ask people to do that and just have a look at the updated information. We are ready and able to set up more pop-up testing clinics, to expand the ones that we already have, such as more lanes for drive-thrus, and also to extend hours. So we are ready and able to do that where it's necessary. Of course, the lines aren't consistent everywhere, and every time we announce a new area for tests, we see a surge in those particular areas. So we will monitor that closely.
I understand that you're waiting to take that advice from the AHPPC, but given people that, in some cases, quite literally unable to follow that 72-hour entry test rule coming from interstate, can't the Queensland government take the lead on this and say, right, we're comfortable with the rapid antigen test, we'll accept that as a PCR test? Why can't we take the lead on it?
Well, because we promise to do this in a safe and responsible way. And we cannot... Well, we have committed to requiring the PCR test. We only opened on the 13th of December and we are well over 1,300 positive cases since then. It is now doubling every 48 hours. We need to make sure that we can manage this and we are not the only state that requires this. We have a plan and a pathway forward. We have said we will stop the testing altogether at the 90% double dose, and the Premier has already announced we may be able to shift the rapid antigen on the 1st of January. But can I also say this, before everyone's too quick to say, why don't we just use rapid antigen? They're not easily available. I don't know if anyone else has gone into any pharmacies or chemists lately, but every one I've walked into, they're selling out the moment they're on the shelves. So to say people should be able to just go get a rapid antigen, they come at a cost, as opposed to PCR tests, which don't. It comes at a cost, and they're not available all the time everywhere. So we would still see delays. We would still see delays of people being able to access that, but we'd rather go with PCR tests, which we know are very, very efficient, and it's the right thing to do that we promise the people of Queensland.
Is that something the
Last
government
question.
would consider providing? The New South Wales is looking at doing that, or is implementing that to offer rapid antigen tests for free. Would Queensland government do the
Well,
same?
I think it's something the Commonwealth should do, honestly. If we move to that, then it's something that the Commonwealth should be looking at.
Just Dr. Gerard, can I just ask you on this question of sort of numbers, and you spoke about being a numbers game. If you have sort of roughly 1,000 active cases and there's 3 in hospital, so you extrapolate that out, maybe 300 out of 100,000 active cases. Have you done any modelling around that sort of an analysis and what would be a sustainable level of active cases in the state at the hospital?
The model is continuously being revised. Sorry. The model is being revised continuously. We have the capacity to deal with the numbers that we expect.
No, but I guess I'm more saying like when the breaking point would be for daily cases in Queensland where hospitals would be overrun, if the whole point of this is to stop hospitals being overrun.
These models are being revised continuously. I mean, these data are coming through. We are gaining more information about Omicron daily and our case numbers daily. So the models are being revised daily. I can't say anything more.
What's the latest modelling?
No, our modelling shows that we will have the capacity to deal with the cases as they arrive in Queensland Health.
Thank you, Ryan. You mentioned a little bit earlier that vaccinated Queenslanders have the potential to have COVID and not even know that they have COVID. Have you done any modelling or is there any indication on how many people could have COVID given our daily case numbers and not know that they have COVID?
No, I haven't seen specific data on that. No.
Just quickly, Dr. You said earlier this week that you're looking at 7-day quarantine for international arrivals. Have you got any update on that?
No. That's the current settings for international arrivals are staying as they are for the time being, so they're not changing yet.
The AMA is calling for more masks to be tighter and more mask mandates. What do you think of their sort of suggestions around mandatory indoors?
Well, if we have fairly extensive, we extended our mandatory indoor mask mandates just yesterday. I mean, in the end, we want everyone indoors to be wearing masks. And I mean, as we said before, in Brisbane it seems to be very effective. Outside, to a lesser extent. I think we have very good settings at the moment. We're still looking at other areas. We continuously look at other areas. But in the end, people need to think, should I be wearing a mask at the moment if I'm in a large group of people? So, yes, I think we have where we are.
Some hospitality businesses say they were better off when the borders were closed. They say, sorry for Mr. Duff. They said 7 days isolation for close contacts is crippling them. What measures are being taken to help businesses?
Last one, very last one.
We've worked closely with businesses in the quarantine arrangements, and we released last week what quarantine looks like as far as who is likely to be a close contact versus casual contact. We understand that it puts pressure on businesses, every business. We just talked about health workers who have got to quarantine. But we do still need this to occur. All of the modelling, every modelling that has been released has always talked about vaccinations being very effective as long as you continue to test, trace, isolate and quarantine. It is absolutely critical and we need to continue those measures. But, as I said before, who actually is caught by those definitions of casual versus close contact is constantly being evaluated as to whether you can refine it, so less people are deemed close contact, which means less people having to quarantine for 7 days. But there is no doubt that when you are deemed a close contact, you do need to quarantine for 7 days. And it is about slowing the spread in the community. We are not at the point of our vaccinations and the boosters in this state to simply say that we can let the virus spread without measures in place. So that quarantining is important, but we'll continue to work with businesses and especially those essential businesses to support them in business continuity. But we do need people to quarantine, and the public health units will continue to work with those businesses as to who is deemed casual versus a close contact. And can I finish thanking the media as well?
Just on the plan very quickly, there were, like a question about the COVID care plan, there were 30
So that's why this material is so important, and it's about empowering people to understand, well, what happens when I get that text and it says I'm positive? Do I have to ring an ambulance straight away? It'll tell you to look at what your symptoms are, to monitor your symptoms every day. Everyone, after they get a positive test, will be contacted by a health professional over the coming days, and then they'll be set on a pathway. They'll be assessed as to their illness at the time and their symptoms, and whether they should be managing themselves at home. Of course, if someone is in any way worried, then they can call 000 or go to the hospital. But this toolkit that we're releasing today, I hope gives a lot of people comfort in how to manage their illness at home, like they would when they've got a cold or other illnesses at home, where you don't have severe symptoms and don't need to be hospitalised. We don't want to put people in hospital unless you really need to be there. And I'm sure you'd much rather be at home and recuperating at home. And that's what this toolkit and this pathway is all about. Thank you to the media for the great work you've done over 2021, because your messaging to the public and keeping them informed about COVID and the measures we're putting in place is absolutely crucial. And I hope you all get a lovely, safe Christmas with family and friends as well. Thank you.
Thank you.
Thank you, Mikey.